all doing? My name is Ayo and I'm back again with another video. So today we are going to be going over the should questions for the ASWB exams. So as we all know, with the exam, there are questions that talk about first, next, best, most, and today we're going to go over should. So the should questions that I'm speaking about are not the should questions that say what should the social worker do first or next. As we know, if they're talking about what should we do first, right, we're doing what's first in the helping process based on what the question stem says. These kind of questions that I'm talking about are just the ones that say, hey, the social workers work with the student says XYZ, what should the social worker do? Okay, that's what we're going over. So something that I want you all to think about is when it comes to the should questions, something that's super important are our code of ethics. That is what we're leaning into when we're making these decisions, right? So with these questions, they're not asking you what is the first step or what's most effective. It's asking you what aligns with the social work ethics, client's rights, and our clinical reasoning. In this kind of situation, your role is to protect the client, respect their autonomy, and stay grounded in our core values and ethics of social work. Okay, that is what these should questions are talking about. So you are thinking about, hey, what is respecting the client's autonomy? Hey, what goes along with our code of ethics? Um, you know what answer here aligns with my role based on this question stem. That is what you're thinking about. Okay, so now I'm going to go over some things to kind of think about, as well as some examples of some questions that may pop up, and then like we do in all my other videos, we're going to do some practice problems. So like I said before, things to remember: respect and client autonomy. Why is that important when it comes to the should questions? Clients have rights to make their own informed decisions. So a question may pop up where it's like a social worker feels, so a client tells a social worker they are unsure about starting medication and would like more time to decide. What should the social worker do? So what the social worker is definitely not going to do is advise the client on what medication to take. We definitely don't do that. That is not within our role. We are not psychiatric MPs. We're not psychiatrists. We do not give meds. But what we may do is talk through what the client's experiencing, talk about medication as a whole, like telling a client that medication, like if a client says, hey, medication is not working, that medication usually takes 2 to 6 weeks depending on the med. Also, we may put them or advise them to go talk to their psychiatrist. We may do something like that, but we're not going to be telling a client what medication to take. We never will do that. We will not do that. We will not suggest what medication to take. That is not within our role. So if a client is like they're unsure, we may talk them through it, right? Maybe talk about the pros and cons of starting medication, or talk about maybe what are some thoughts that they're having about starting medication, maybe some concerns or worries, and just talk through, and then also still advise them or encourage them to go see and talk to their psychiatrist for any kind of specific questions on the medication that they are taking or may be taking later on. Okay, so next is uphold ethical boundaries. So you must stay in your professional role and avoid dual relationship. This is something so important. There are questions that pop up like the social worker is invited to their client's wedding. What should the social worker do? Those kind of situations, we want to avoid dual relationships at all costs. So an answer may look like, gently decline the invitation to the wedding and explain to your client why you wouldn't do it. Something like that. I know sometimes in real life when people actually work with people, they may actually go to their client's wedding. But for this exam, you want to make sure that you will just remember we want to avoid dual relationships at all times. So in those kind of situations, we're going to decline going to a client's wedding. So yeah. Next, maintain therapeutic relationships. So preserving trust helps ensure emotional safety and engagement. So in these kind of situations, let's say you are working with the client and you keep talking over the client, or the client thinks you're distracted. What should you do? You should acknowledge and validate their concerns and give them space to kind of talk about it, right? That's what the social worker should do. You shouldn't ignore it. You shouldn't wait for the client to say something about it. But if you know that they already said something about it, but like if you shouldn't avoid it, you shouldn't try to change the subject or something like that. You should give them space to talk about it and let you know what they're experiencing and take ownership if you are distracted, if you are looking away, something like that. So informed consent, so important, right? You never act without first explaining options or getting permission. Also, something with informed consent, you want to make sure that your clients understand they have a right to take it away. They have a right to change their mind. If they sign something and they're like, hey, you know what, I don't no longer want to do this, they have a right to say no. A lot of times in contracts or in forms, they'll say like the client needs to give you a written form of communication that they no longer want something. So you just, remind them about that. But the client has a right to say, I no longer want to engage in this. I no longer want to do this. I no longer give you the permission to talk to my psychiatrist. I no longer give you the permission to talk to any of my prescribers. They have that right. So a situation may look like the client shares something personal and the social worker considers bringing it up in a meeting with the team. Now, this is where you would want to let the client know that that's something that you want to do and ask them for permission and have it in writing that you are going to consult with the team about something that they have shared. Okay. So confidentiality. So only share information with consent or with legally or that's legally required. So there are questions that talk about, hey, a client's spouse contacts you and asks for information about how treatment is going with their spouse. There's no release of information on file. What should the social worker do? I would hope you would not tell them a dang thing. I would hope you wouldn't tell them anything. If there's no release of information on file, even if that's their spouse, you cannot tell them anything. So what the social worker should do is, number one, deny that you even have the client as a client and tell them you cannot release any information. Okay? That's what you should do. So next, avoid immediate problem solving. So sometimes the questions will talk about a client having like all these problems, and you don't want to jump and say, okay, I'm gonna fix it. You are not fixing their problems. The client is gonna fix their own problems. You're just a resource. So an example of that could look like a client has issues getting a job. What should the social worker do? Right? You can help them problem solve, engage in brainstorming, help them kind of do a pros and cons of any of the ideas that you got during brainstorming, something like that. But you're not going to say, hey, I'm going to apply to 5 jobs for you because you're having a difficult time. Absolutely not. Or I'm going to reach out to your boss to make sure that they hire you. Again, or they, if you got fired, I'm going to reach out to your boss to make sure that they employ you again. Absolutely not. We're not doing that. And lastly, we don't want to prioritize other people's needs over our clients, right? If the client is our client, their needs come first. If we're working with the child and the parent's like, I want you to discipline my client, discipline my child, absolutely not. Our job is not to discipline anybody's child. That's not what we do, right? Our job is to work with the client. So an example of that looks like a teacher contacts the social worker and asks for personal information about a student without consent. We're not going to give it to them. The teacher wants information, we're not giving it to them. There's no release on file. We cannot give you any information. Or if the parent says, hey, I want you to make sure my child understands this. No, we're not doing that. Or, hey, I want you to make sure my child is listening to me at home. Fix them, right? We don't do that. I'm not in the business of fixing people. So that is that. So like I said earlier, the main things you want to remember: client autonomy, our code of ethics, clients' rights, and our clinical reasoning. That is what's going to help guide you for these should questions. I hope that made sense. If you have any questions, you can leave a comment, but let's get right into some of these practice problems. So a 15-year-old client shares with a social worker that they are thinking about quitting school, but asks the social worker to not tell their parents. What should the social worker do? So we should respect the client's confidentiality and explore their feelings further, inform the parents immediately, refer the client to a school guidance counselor, or schedule a family session without telling the client. So what did I just say? Client autonomy, self-determination, our clinical reasoning. What should the social worker do here? I hope we all picked A, and we're respecting the client's confidentiality and exploring their feelings. Why is A the correct answer? Let me highlight this. A is the correct answer because confidentiality is critical, especially with adolescents who have the decision-making capacity. This is a 15-year-old. They're not a 2-year-old. They're not a 3-year-old. They are a 15-year-old, okay? The social worker should explore the issue and provide some support without violating their trust unless there's a safety concern. Like I said earlier, adolescents have rights too. Unless they're going to harm themselves, harm somebody else, or they tell you that, hey, unless they're going to do those two things, we don't need to tell anyone what they have told us, okay? So, yes, they want to quit school. That's a decision that they're making. As a social worker, what we should do is respect their confidentiality and explore their feelings and thoughts further. That's it. Okay? That is why A is the correct answer. Next, a client tells a social worker that they are considering reconnecting with an abusive ex-partner. What should the social worker do? So should we warn the client not to contact the ex? Help the client safely plan and explore their reasoning for wanting to contact their ex? Contact the ex to discuss the client's concerns? Notify authorities about potential risks. What are we doing here? So remember our code of ethics: right to self-determination, client's rights, autonomy, all those things. What is the best answer here? What should the social worker do? So in this situation, the what the social worker should do is help the client safety plan and explore their reasoning for wanting to contact their ex. Why? The client's autonomy must be respected. Instead of directing or warning, help the client reflect and safety plan. This promotes empowerment and safety without assuming control. Okay, warning the client, no, no, not warning. That can come off as judgmental. We're not going to warn. They're an adult, and that's what they choose to do. That's what they choose to do. Contact the ex. We definitely won't do that because we're going to be violating confidentiality. Notify the authorities. Why would we notify the authorities? Again, confidentiality. So what we should do here is help the client safety plan and explore the reasons. The reason why we're helping them safety plan because it says in the question stem that they're reconnecting with an abusive ex, right? It's established that this person is abusive. That's why we are helping them safety plan. Next, a hospital social worker is asked by a nurse to share a patient's treatment update with the patient's spouse. The patient has not signed a release of information. Sorry, the patient has not signed a release. What should the social worker do? Okay. Share general information since that's the spouse's family. Ask the nurse to handle the disclosure. Decline and explain that no information can be shared without consent. Or D, speak with the spouse privately to assess their intentions. So what was I just talking about? Autonomy, confidentiality. I just talked about when it comes to spouses and releasing information. If there's nothing on file, what do? We definitely decline. We decline. Okay, even if it's the spouse, we decline and explain that no information can be shared without consent. Why are we doing that? Without a signed release, sharing information breaches confidentiality. The ethical choice is to protect the client's privacy and educate the nurse on boundaries. That's it. So that is why C is the correct answer. Next, a client expresses frustration with their therapist. A client expresses frustration that their therapist seems distracted during sessions. What should the social worker do? So, should the social worker defend their approach and explain the structure of therapy? Invite the client to share more and explore the impact on the relationship? Ignore the feedback and continue the session? Refer the client to another therapist? What should the social worker do? Again, what are we pulling from? Client's rights, autonomy, ethics, rapport, relationship. What should the social worker do? So the social worker should invite the client to share more information and explore the impact on the relationship. Why should the social worker do it? Therapeutic relationships are built on collaboration and trust. Validating and exploring feedback enhances engagement and models healthy communication, right? So we're using clinical reasoning, bringing back rapport, right? Not just dismissing and ignoring what the client says to you, right? The client thinks you're distracted. Invite the client to share more. Explore how it impacts their relationship. You're not going to just refer them out to another therapist. Ignoring their feedback definitely wouldn't do that. That would really mess up the relationship and the rapport. And then defending their approach. I don't see what approach there is that's going to tell you to be distracted when you having therapy with your client. So B is the correct answer here. And lastly, so a parent asks the social worker to write a letter stating their child is ready to return to school, though the child has not been evaluated. What should the social worker do? So should the social worker decline the request and explain the need for an assessment? Write the letter as a favor to support the family? Consult with the school staff first? Ask the parent to sign a release before writing the letter? What should the social worker do here? So remember our ethics. Remember client autonomy. Remember core values. What are we doing? So, as a social worker, would you sign a letter before you did an evaluation? Would you write one just because someone asked you to do it? I hope you would not. Okay? The correct answer here is going to be A, decline the request and explain the need for assessment. Why is the answer A? Making clinical recommendations without evaluation is unethical. We don't do that. Okay? The social worker should explain the process and protect their professional integrity. Okay? So, that is all I have for today. Like I said before, when it comes to these should questions, what are you pulling from? Our code of ethics, clients' rights, and our clinical reasoning. You're remembering your role as a social worker as well as whatever your role is in that question stem, and that is how you are answering the question. I hope this was clear and you understand, and this is helpful when you answer the should questions. If you have any questions, leave a comment, and I'll see you all real soon. Like I said before, on my community tab, I'm having a free study group on June 22nd. I don't know the time yet. I'll announce the content sometime next week, and if you're interested, you can show up. But I'm having a free study group on June 22nd. If you like my comment, I invite you to please subscribe, leave comments, engage, and I'll see you all real soon next time. Good luck studying. Bye bye.